Welcome back to this special edition of the Hodge-Cast. Today, we're going to be debating biological sex and gender identity. What is a woman in 2025? And are there really over 100 different types of genders? Well, hopefully we can get clarity on those questions and more. As here to debate this is veteran journalist and broadcaster Julie Bindel, fighting for biology and sex, and opposing Julie is the founder of GenderGP and trans activist Dr. Helen Webberley. So welcome to the show, ladies.
Thank you.
Thank you.
I suppose what we'll do is the format will be I'm going to remain very impartial throughout this discussion, or as impartial as I can be, and I'll just fire the same questions to both of you, give you equal time to answer. Don't feel obliged to not interject one another, but obviously if it becomes a bit of a slanging match, my role is to referee this as well. So first off, Julie, just give a little bit of an overview of who you are, and are you familiar with Dr. Helen and her work?
I am, and it's really good to be here with you today, Helen. I'm really delighted to have the opportunity to have a discussion. I'm a feminist campaigner, and for all of my adult life, I've campaigned against male violence towards women and girls, which I don't think is an inevitability. I don't think boys are born programmed to abuse or to hurt women and girls or each other. And to do that, I have been involved in setting up rape crisis centres, a lesbian phone line, and campaigned also for single-sex hospital wards for women back in the 1980s, as well as the introduction of the law to criminalise rape in marriage, which was introduced in the early 1990s. So they're my priorities, and I do that primarily through my journalism, making podcast series and having discussions like this.
Thank you, Julie. And the same question to you, Dr. Helen, a little overview of who you are. And obviously I know Julie's just outlined that, but was you familiar with her work prior to today?
I'm Dr. Helen Webberley. I'm a mum, a woman, a medical doctor trained in the UK. And I started in my medical career in sexual health. So I've worked probably in some of the similar places that you're talking about, working with victims of sexual assault and also in sexual health in general. And then 2015, I started working with transgender people. And I was just a little bit shocked that in our era today, we still were facing exclusion and discrimination against a minority group. So it's become my focus over the last 10 years, really, just supporting transgender people, mostly in healthcare, but then also in everyday life.
Okay. And had you heard of Julie prior to today?
A little bit.
Okay. No, fantastic. So we've kind of done the introductions as to who you are. I suppose the first question, and I'll fire this over to you actually, okay. Dr. Helen. So what is gender? What's the definition of gender?
Well, I think gender identity is, I think, probably what you're asking. And it is how somebody perceives themselves in their own body, in their own space, in the world about them. So it's an identity, if you like. It's how somebody sees themselves and their place in the world, the way that they want to express themselves in the world. That's what gender identity is.
Okay. And the same question to you, Julie?
Well, what Helen's just outlined sounds to me like personality characteristics. Gender and sex are two distinct things, and often, and for decades, gender has been used to mean sex. And I think it's because people think the word sex is a little bit naughty. So, for example, gender-based violence, they mean sex-based violence. And then there's, of course, the ideological use of the term gender, which my understanding of is sex stereotypes. And sex stereotypes are harmful. And the very first thing that I learned as a girl growing up with brothers and quite a rough housing estate with a fair bit of, let's just say, oppression of women and girls in its raw form, is that femininity and sex stereotypes are harmful to girls, and it's imposed upon us as the female sex. And that sex stereotypes are also harmful to boys, although they can gain privilege and benefits from them. So being tough, being macho, being masculine, and having dominance across every single institution in the land over women and girls. So the first campaign I was ever involved in was to expose sex stereotypes as harmful and to say girls don't have to play at femininity or have it imposed upon us, and that we can live as we wish. And it is not abnormal for girls to like playing with trucks and climbing trees.
Okay. And what would your response to that be, Dr. Helen?
Well, I think Julie's coming from talking about the female side of it and talking about this idea, which I not necessarily agree with, that all men are in a privileged space. I don't think just because you're a man or a woman gives you any privilege. I think there are some men who have privilege, and I think there are some women who have privilege. I don't think it's a sex-based thing automatically. And I feel sad for women and girls who are mistreated by anybody, but I don't think that we should just presume that it's only men that would mistreat a woman or a girl. And I don't think we should forget that some men are mistreated terribly by women and girls. So I think maybe I'm more in the middle of everybody deserves a safe space to live and breathe and exist. And there are baddies in this world, but I don't think that we should portray one particular kind of person as always being a baddie.
So can I ask you, Helen, when feminists like me did argue for single-sex refuges, rape crisis centres, hospital wards, for example, were you against female-only space then?
I'm not against female-only spaces at all. I think that everyone deserves to feel comfortable in hospital. Everyone feels it's a shame that we need rape crisis centres, but it's not just women who are victims of rape. So we need places where people can go when they have been abused or faced crisis, that they feel safe. I'm not against single-sex spaces at all, and I think hospitals and refuges are important for people. Then we need that place.
I think I probably asked the wrong question, which is my fault. In that case, we mentioned rape. Rape can only be committed in law by a man, and men are also victims of rape, but proportionately, the majority of victims are female. But nevertheless, male victims of rape matter.
I don't think we can say that, actually. I mean,
No, we can. We can. Every single government-led and piece of credible research across the world that has been done on sexual assault, on rape in particular, shows that the majority of victims are female. Nevertheless, I care about the male victims of rape. But one thing...
If I just come back on that, we have to be careful in the reports, because there will be bias and skew, because what we're talking about is reported cases. And I know as a doctor there are many cases of abuse on men, whether it's from women or by women or by men, that go unreported.
So only men can commit rape, and that's in the law, it's enshrined in law,
that's a legal definition that people go back to, of the legal definition of rape by a penis.
Let's stick with the legal definition.
If you allow me to finish, but sexual assault, there are very many ways for a sexual assault to be committed.
Of course, but let's just go back to the single-sex spaces. When women, myself included, were setting up refuges, rape crisis centres, and arguing for single-sex facilities, because of the danger of sexual violence and harassment from men, did you ever think that's really unfair, because it's only it's only a minority of men that commit these crimes? Why are they tarring one entire group with the same brush? They're calling half the planet rapists. Did you find yourself angry that by keeping men out of refuges and hospital wards that women were entitled to be in as a single sex, did you think we were maligning all men?
No, not at all. I don't know where you'd find. Why would you think that I would be thinking you were maligning all men?
Because you have said repeatedly, on several occasions, that by saying that we shouldn't have the likes of Isla Bryson or Karen White to male sex offenders who were trans-identified, who ended up in women's prisons, that by saying that trans women, as you would refer to them, shouldn't be in these spaces, we were maligning all trans people. We weren't. We were saying that they are men, and a sizable proportion, a sizable minority of men commit these crimes. We never talked about banning trans people from women-only spaces. We talk about keeping men out of women-only spaces.
I'm not sure what you're guessing. It seems that you're telling me what I've said.
Well, you have said it.
Okay, so what is it that you think that I've said?
Okay, so what you have said repeatedly, I've heard on several occasions, that by saying that trans women, as you would refer to these men, shouldn't be allowed to be in women's refuges, rape crisis centres and the like, that we are tarring an entire community, you may not have used that term, but that we are maligning an entire community as sexual predators. Did you ever say that when we said men should be out of our spaces?
Do you want to find this bit where I've said that? Because you're speaking for me. Maybe it would be better if you asked me a question rather than told me told the world what I have said.
Obviously several people will, as they're watching this, will be Googling to see if you have said that.
Okay, that's fine.
So let me ask you a direct question then.
That'd be better.
When I say there is no place whatsoever for trans-identified men, trans women as you would refer to them, in women's changing rooms, bathrooms, hospital wards, any female-only space whatsoever, which is what I do argue, what do you think to that statement? What's your view?
My view, what I think to it is, I think it's very unkind. I think if you're going to create a space for females, a space for women, then I think that space would include all women. And I think it would include black women and white women and able-bodied women and disabled women and tall women and short women and black women and trans women and cis women. I think if you're going to create a space for women, and you've already said that you call them something different, but I call them trans women. So if you're going to create a space for women, then all women should be included.
But trans women are men, and so how can you possibly suggest that anyone, any feminist that fought for these spaces, because it was feminists that fought for them, would exclude short women or black women? And that's on par with saying that biological males should be kept out of those spaces. So in fact, you're not in favour of single-sex spaces, are you?
As I said, again, you're speaking for me. I am in favour of single-sex spaces as long as if you create a space for a particular category, then all people who fit into that category will be welcome there.
So you, by defining trans women as women, you are arguing that it is in fact still a single-sex space. In other words, that we should include men, biological men, but however they identify.
I don't know why but you see, the difficulty we're going to come here is that you call these people, who are people, let's not forget, the people that we're talking about today, you call them men when actually they're women. So you've created a women's space, but then you're saying, oh, actually you're not a woman. And if we just think about, for example, the Equality Act, and it's not whether I think they're women or whether they think they're women or whether you think they're a man, the Equality Act has a protected characteristic where people can reassign their sex. That's the word.
Gender identity.
Sex.
It is a protected characteristic, gender identity. And I do know the Equality Act really well.
Do you? Okay, well, I think listeners, if you just want to just take 5 and Google it, the Equality Act says gender reassignment is the protected characteristic and the reassignment is of sex.
But it's not, because we know that we can't reassign sex. We can.
But if you just think, I don't know, Dan, whether we want to bring up the Equality Act, because it's actually quite an important point.
I think for this moment, I think we just kind of need to outline sort of where you guys are coming at it from different avenues, mainly just for the listeners. So certainly, when we're bringing up the Equality Act, you're just to sort of elaborate on that a little bit.
Well, I think what we're struggling is with the wording. I don't know whether we wanted to actually get the official wording. It might help the discussion, but that's up to you.
The problem that we have is if we can take any self-identification, for example, because this is what we're talking about, a biological man who declares that he's a woman, that he obtains a gender recognition certificate, that he then becomes, in your mind perhaps, if he tells you he's a woman, he becomes a woman. Is that right? Because the problem that we have here is Rachel Dolezal, who is the white American woman who said that she was mixed race, black, African American, and masqueraded as part African American. And then it was discovered that she was in fact white with a pure white lineage and heritage. That if she tells us that her identity is African American, why should she be excluded from a black only meeting when the counterpart is a man who tells us he's a woman should not be excluded from a single sex space? Do you see any difference in that at all? She said she believed she was African American from childhood.
Well, I mean, when we started this discussion, you said that gender identity felt to you like a personality. So, the best person to ever kind of put a label on their own personality or their own identity, I don't think that would be me. You said that if a biological man said that he was a woman and then that I would say he's a woman, I mean, it's not my position to say whether he's a woman or a man. That's an individual's place to explain who they are in themselves and how they want to live in this world. It wouldn't be, I would feel terribly ashamed of myself if we had a trans person here and you and I were sitting discussing what their identity was, because the only person who would be able to say that would be them.
No, the biological reality is that there are two sexes, male and female, that personal individual identity is something that is completely different from the biological reality. And that if you're saying that it takes somebody to identify that their gender is female or a woman, however you would describe it, or they would, that means we don't have a category of sex. That means we can't have single sex spaces. That would be rendered completely obsolete.
Well, it feels to me that the work that you've done, which I think has been good work over your career, from the way you describe it, the work that you've done has been good work because you've set up spaces for people who have experienced trauma.
For women and girls.
And it seems to me that now that perhaps if we were to rewind, and perhaps if I was going to start again and set up those spaces, I would set up spaces where everyone could feel comfortable. I would set up spaces where somebody who had been the victim of sexual assault could find a space to talk about that and get mended from that. But I wonder whether by making it a women's space rather than a safe space for anybody who has suffered that crime, that maybe we've caused a disservice here. And maybe that feels to me that it would undo your good work by allowing other types of women into your space. But if we did allow other types of women into those spaces who'd faced the same traumas that the women that you're talking about, I think that would feel more inclusive to me. That would feel like a more progressive world, that we invited people who had been the victim of sexual assault in, rather than only biological females in.
So what you have just done is you have just given a speech against single-sex provision for the victims of rape and sexual assault committed by men. We're talking about these very specific dangers that women face, the fear that women and girls face, the trauma that they face because of what men have done to them. We've heard evidence in the interveners. No, you can, but I'll just finish. Okay. We've heard evidence in the interveners on the Good Law Project challenge this week of a woman who was so traumatised after a sexual assault in a bathroom that she is now deeply disturbed at the sight of any male person in that facility. So what you have just actually made an impassioned speech about is the destruction of every single thing that feminists have set up for the victims of male violence towards women and girls. We saw this play out with Edinburgh rape crisis with Riddle Wadwer, who was the chief executive, a male, who refused to accept that there should be a single-sex provision anywhere in Scotland for the female victims of male violence. You've just said, basically, we should just have a facility for people who are traumatised by people. And I'd love to know why men who are raped, and I include trans women in that category, why they haven't set up the facilities that we worked tirelessly to do. Why should our spaces be destroyed?
Okay. So the question I was going to ask is, so in your, for example, in your women's only refuge for sexual assault, are women who have been assaulted by females allowed in there? Or is it just women who have been assaulted by males? I wasn't sure.
In women's refuges, where women are recuperating and being kept safe from male predators, and often they are in danger of their lives, and we know this because one woman every 3 days dies at the hand of a current or former partner across the UK. So they are being kept safe from male predators. There are services for women who have been sexually assaulted or the victims of domestic violence in relationships with other women. These cases are very few and far between, as are the men who are the victims of sexual and domestic violence from women. And we know this because over the years, men's rights activist groups have set up refuges for men escaping violence, and never a bed has been slept in. And the morgues tell us the story about who the victims are of serious and sustained violence. And these are women. The morgues are full of women who have been murdered by men in violent rages. And the sexual assault victims that are seen by police, by sexual assault referral centres, contacted by rape crisis centres, have to present to A&E with injuries because of these sexual assaults, are assaulted by men. And I think that every single sexual assault victim and survivor should have somewhere to go. But the job of feminists in keeping women safe from male predators is something that I have focused on, millions of women around the world have. And you've just made, as I said, an impassioned speech to destroy all of that work by allowing men to enter them because they say they're women.
So can I just ask that question again? So if you have a woman who, as you have a female-only space for victims of sexual assault, and if she is abused or assaulted by a woman, is she allowed in your space?
I have no idea whether or not any of the services for women only have been presented with a scenario where a woman has been sexually assaulted by a woman. But I can't imagine any woman being turned away from those facilities. The problem here, Helen, as you know, is men. But if you class a subset of these men as women, all bets are off. Sex becomes obsolete as a category. Biology becomes irrelevant. If you include some men in that category, then we don't have single-sex spaces anymore.
And the other point I was going to make from when you were talking is you were talking about my views undo all the good that feminism has done. And for me, as a woman growing up, I'm incredibly grateful to the work that feminists did. Incredibly grateful because it gave women and men the equal opportunities in education, in employment, in pay, in voting, and to move away from the way you were describing at the beginning, where the woman is at the kitchen sink and it has to be the maternal one has to stay at home. And I'm incredibly grateful to feminists for giving women equality. But certainly growing up, my impression of feminists wasn't anti-men. It was pro-women. But I think what I'm hearing more from you is a very anti-men view rather than an equal rights for men and women view.
When I started doing this work, the stereotype, and it remains, is that feminists are man-haters. That if you talk about male perpetrators rather than female victims, you are a nasty piece of work and you're being unkind to men. And most men understand that, especially if they're not in the significant minority of men that do carry out these attacks or instill fear through harassment, that they are the good ones. They're not the bad ones. The majority of men understand that. That's why there was no huge backlash against setting up the services that we've outlined previously. They didn't come shouting and screaming that we're branding all men as rapists by saying we want single-sex facilities where no man can enter. It would be really easy if we could just look at a man and he's got rapist or harasser tattooed across his forehead and we say, right, you can't come in, but you, the nice one, you, Dave, you can come in. The world doesn't operate like that, as we know.
But I thought we were making these spaces for people who've been hurt or
for
abused.
For women who've been hurt and abused.
Rather than Dave and who doesn't look as nice as Simon or whatever your analogy was. I don't understand that.
We have to keep all men out of these spaces, not because we say all men are rapists. We never have. Not because we say all men are horrible, or even a minority, or even a majority are horrible or a danger. What we say is we don't know which men are a danger. We can't possibly know that. That's why we have the existence of single-sex spaces. And we can't differentiate between the bloke we think is really nice and the man that looks a bit dodgy. So we keep all of them out. And there hasn't been a big kerfuffle about that until trans ideology came along. And then it was, well, he says he's a woman, so he should be able to be in that prison. I've interviewed women in prisons. I've actually gone into the prisons and interviewed women who have been sexually assaulted by men who claim to be women. The prison officers are terrified to say anything to these men who are clearly behaving in a predatory manner, as Karen White was, with his erection rubbing against women in the queue for their breakfast. And they've been terrified of saying anything in the past, in case they're called transphobic. So we need to keep all men out. And that includes those that you would define as trans women.
Well, I don't define them. They define themselves.
That's the problem.
That's the problem.
Well, just to kind of bring this on track, ladies, I think you're both coming at it from, obviously you've got strong opinions, obviously you're trans advocate and you've been a hardline feminist all your life, Julie. So obviously I just kind of want to paint the picture, lay the foundations of why we're looking at this sort of, it's not one secular view. Calvin has kindly pulled up the protected characteristics, which will segue quite nicely to kind of what I was going to ask next. Dr. Helen, I believe you mentioned, or who brought up these initially? Was it yourself, Julie?
I don't remember.
You can't remember. Okay, well, it doesn't matter. So we've got the protected characteristics there. So for those who are listening, obviously this will be on the screen on YouTube, but for those listening to Spotify, they're listed as age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex and sexual orientation. So just highlighting the gender reassignments, correct me if I'm wrong, either of you two, it's your wheelhouse rather than mine. A trans who is going through gender reassignment, a trans person who's going through gender reassignment would come under that category. Yeah. Is that correct? So what about a trans person who isn't going through gender reassignment? What category would they still go under? Presumably not the gender reassignment category.
Well, the Equality Act doesn't define how far you have to have gone along gender reassignment. So gender reassignment doesn't mean, for example, having a gender recognition certificate, which is the kind of last stage in legal reassignment. And it doesn't mean that you have to have undergone surgery, for example, or have to take medicine to change your hormones. It's gender reassignment is somebody who had a sex assigned at birth as, for example, male, who now has reassigned that to female. Okay.
Your take on that, Julie?
So you're talking as if we have self-identification as a law in this country?
If you look at the Act, it doesn't require somebody else to give you a diagnosis or someone else to label your gender. It is your gender identity to reassign and to declare, yeah.
So would you then support any person who was born male, who then identifies as female, to be legally female?
Yes.
And this is where the problem is, because, for example, I was recently in Vancouver, where they have self-identification, which we don't in this country, as you know, and that's what began...
We do have self-identification.
We don't have this in law. We do not. The Equality Act sets out gender reassignment The Supreme Court made it very clear that under the Equality Act, sex is biological sex.
But that's not what we were talking about. We were talking about whether in this country we have self-identification.
Well, we don't. We don't because we have the right to tell men whether they identify as women or not.
We're not talking about the right for you to tell somebody else whether they're a woman or a man.
No, it's the law. We do not have self-identification as law in this country. Remember,
I think can I just clarify for the listeners what you mean is to have your birth certificate changed legally from male on the birth certificate to female. To do that, you have to go through a process. But in order to your own gender identity is yours to declare in this country.
Right. Well, we disagree on that. But as I was talking about Vancouver, I was in what's North America's poorest district, which is the downtown east side. And I don't know if you've been there, if you've ever been there, Dan, but it's pretty horrific in terms of the poverty, the violence, the drug abuse, people dying of fentanyl overdose on the street. It's grim. There is one women's centre in this area, and it is open to all people that identify as women. That means men go in there. That means women don't go in there because those women have been abused. They have been pimped. They've been beaten. They have been abused pretty much all of their lives, those women. Their life histories are hellish. And men go into those women's centres now, just as they do the...
So are you saying they don't have any women in there at all? No women go in there? Is that what you mean?
Some women go in. Some women go in out of absolute desperation and talk about how triggering it is, how awful it is, how traumatising it is for them to be told this is a women's centre, because the violence is constant from men for these women, and most of them are in prostitution. And I went into one of the centres in the downtown east side, and it was, the last time I was there a few years back, an exiting safe house for women who were leaving prostitution. And there were just blokes sitting around a table, just bearded blokes, big blokes, small blokes, but just men, because it was a nicer facility for them than the quite horrible male hostel down the road. And there were no women in there. And there were
no women at all.
There were no women at all. And this is a story that I hear time and time again, that because of trans activism and because of self-identification, women are excluded from the spaces that were set up for them.
So in Vancouver, I haven't been. It sounds horrific. Well, I'm sure the whole of Vancouver isn't like that.
No, it's the downtown east side.
Okay, well, I don't know whether all of the downtown east side, because I wouldn't want to kind of put that image on the whole of it, the area. But obviously, people who are experiencing that is, it's horrific. But are you saying that the men that were in this hostel, because it was a nicer hostel than their one, are you saying that they were all transgender women? Is that what you're saying?
No, I'm saying that because of self-identification, any man can just declare that he's a woman.
But were these people? I'm not clear. You're on one hand, you said that they went in there because it was a nicer hostel than the one for men,
and they can legally.
But now you're saying that they were not transgender women. But are you saying that they were pretending to be transgender women?
See, another difference that is a crucial difference between our views is that you believe that there are true transgender people and that some could masquerade as transgender people.
But I
believe they're all the male sex. They're all men.
You gave my view again then. But and you're saying, if I'm right, you're saying that I believe that there are transgender people. Is that what you're saying?
Yes.
But our law protects transgender people, so they must exist. It's not. I don't think I'm an outlier in thinking that there are transgender people in this world and in our country.
There are people that live as the opposite sex. That's absolutely right.
Yeah, because it's in our law. So I don't think for you to say to me that we have different views, that I think that transgender people exist and maybe you don't, I don't know, but they do. It's a fact.
I think the point that I'm making is that if you have self-identification, and this was played out at the Supreme Court that I attended for the 2 days of the arguments, then you've got Diane, who is a bloke with a beard and has...
Is Diane a real person, by the way? Or is someone that you're making up? Just in case Diane is a real person, I think we should...
Diane is not a real person.
Oh, okay, that's
well,
fine.
I mean, Diane will certainly exist in other forms, but you have Diane who says he's a trans woman, and you would say, presumably, he's a woman.
If Diane says that they are a trans woman, then her pronouns would be she. So Diane would say that she is a trans woman, right? And if she has a beard as well, then it's actually okay for women to have beards.
Right. So what's to stop, then, any female facility just being 90% blokes like Dave, that you would...
Which one's Dave now?
Well, Dave is Diane. Dave is calling himself Diane.
Okay. Well, okay. Well,
right. So just to kind of bring it a bit more amicable. Let's. I understand where Julie's coming from, and equally I do with yourself. You're advocating for equal rights in these spaces, but as I think you mentioned at the start, there are bad people out there, unfortunately, and there are people who will take advantage of situations like this. So obviously this fictitious Diane / Dave is an example of a bad person, I guess, who's using the law, if you will, to be in these spaces. What would kind of your take be on that? And do you see why that can be frustrating?
I can see that if there was somebody who was Dave, who actually identified as a man, who then said that his name was Diane and pretended to be a woman, and then went into a single sex space designed for women, I can see that would be, I wouldn't like that. That would not sit well with me, because Dave is not being an honest, true person. But actually, what I think we need to be very careful of is that fictitious Dave doesn't mean that every single transgender woman in our country doesn't have the rights that women have, because Diane is a transgender woman. So I think that, we can come up with these fictitious examples, but we just need to be very careful and Julie's mentioned, I think, 3 or 4 separate names which are real cases, but we've got, the last census counted 262,000 transgender people in our country, and we know that there are many more than that, and we need to be careful that we don't limit their rights simply because we might have a fictitious person, Dave, pretending to be Diane.
Well, both Dave and Diane are pretending to be women. But let's look at the census.
What? Hang on a minute.
Well, because for a man to claim to be a woman, that is a fiction. It is a pretense.
I think so. Are you saying that transgender people don't exist? Is that what you're saying?
I'm saying that men can't be women. I'm saying that.
But no, answer my question. Do you think?
No, I don't think that I don't think there's such a thing as being trapped in the wrong body.
I'm not asking that. I'm asking, do transgender people exist?
People who live as the opposite sex.
Do transgender people exist?
People that live as the opposite sex exist. They are masquerading and living a fiction. But I don't believe in the concept of transsexuality. I don't accept the diagnosis.
Even though it's a protected characteristic in our law.
I believe that people should be protected from discrimination. I believe that people, including those that are trans-identified people, should be protected in law from discrimination. I firmly believe that.
So you do believe that there are transgender people in law?
No, I firmly believe that transgender-identified people should be protected.
What do you mean by transgender-identified person?
Well, we're talking about men.
What does that mean?
We're talking about men here that say that they are women. And if they live as the opposite sex and they face discrimination, if they face prejudice, if they're screamed at in the street, if they're laughed at in a police station when they've had an examination and they're the victim of a crime, for example, they should be protected from that discrimination. But I wanted to ask you about the census.
Can I just go back a minute before we do that? I'll hold that thought. So what do you mean transgender identified? Because transgender isn't an identity. It's an adjective.
I would say it's an identity.
You think identity is transgender?
Yes.
So, and what other ones are there of this category that transgender is part of?
I don't understand what you mean.
So if you say transgender is a category of what? Of gender? I mean, are you saying that we have male and female and transgender?
No, I'm saying we have 2 sexes. We have male and female.
Right. But when you say transgender identified, you're saying they identify as transgender, and I'm wondering what you mean by that.
It's quite straightforward. They identify as something which is they live as the opposite sex. They live under a fiction that they can be the opposite sex.
But their identity, because you're using it as an adjective for identity, transgender.
It is an identity.
Identity. But the identity that we're talking about is their gender, which is male or female. So I'm just questioning.
I disagree. I don't think a gender is male or female.
So obviously, I think the confusion for most people would be obviously this whole definition of gender. And I know you outlined what, gender identity is, and obviously you've got your verdict. I said at the start of this podcast with the notion of 100 different genders. Is the truth on that, Helen? Because obviously I know when you've been on Piers Morgan and he's quite obsessed with this sort of question. I don't want to make it come across that way. I'm genuinely intrigued. Is the notion of 100, or maybe it's not a notion, different types of genders? What would your kind of stance be on that?
Well, I certainly couldn't list 100 different genders for sure, and I think we need to be careful. I'm not very keen on kind of labels, if you like. Labels are not my thing. But how somebody experiences and lives and sees their own gender is up to them. And if they want to give it a different twist or a different label, then absolutely. But what I do know is that we definitely can't fit the whole world into two boxes of gender identity, male and female. And we know some people are a mixture of male and female in the way that they identify, and some people don't feel that they identify with either male or female. And the easiest one that we know is somebody who is non-binary, and binary simply means one or two, black or white, male or female. And they don't feel that male or female. And I've met many non-binary people who don't feel that the male label or the female label is something that fits for them. So I couldn't name 100 but different genders. But also I do know that in different cultures they have different labels, different names for gender identities. And I totally respect other cultures and the way that they want to see and classify their gender in their countries and cultures.
So could I ask you about a child's gender identity? Because obviously this is what many people know from your work, that you have prescribed hormones to children, puberty blockers as they're known. And
well, hormones aren't puberty blockers, by the way.
No, but that you have...
And you don't prescribe them to children because the children don't need either. But
okay,
I get your point.
So let me start again.
Yeah.
So you have treated, as you would refer to it, transgender children.
Transgender adolescents is
right.
the kind of medical term.
Okay,
yeah.
So what do you think about the statement that Nancy Kelly, I think, made from Stonewall when she was chief exec, that children know their gender identity from as young as 2? Would you say that was correct?
I think, I've spoken to many transgender children. And when I say children, I mean young. So if I just for clarity on the kind of medical terminology, a child is a prepubescent child. An adolescent is when you started puberty. An adult is on completion of puberty. So I've spoken to very many transgender children, so before puberty, and their families. And whether or not they had the language to explain what they were feeling, they all have the common story that something was different. And if you ask those families and those children, when do you think it was? It's a blur, because we don't often remember things from before we're about the age of 5, and that's kind of when conscious memory starts. But if you speak to the family, they'll say, well, I when I think back to when they were even 18 months old, I could see that the way that we see gender was different for them.
And what about the statistics from both the US and the UK about desistance, about gender non-conforming children, as one phrase that's used to mean girls that don't necessarily like pink and play with dolls, and boys that don't climb trees and play with trucks? That the overwhelming majority of those children that said they were the opposite sex grew up to be lesbian or gay or non-heterosexual, let's say.
Okay, that's not quite right. So, and again, I think I'm not one of those who favour the pink for girls and blue for boys and trucks and dolls and things like that. But I think that children who experiment with different gender roles, different clothes, different toys. I think it's wonderful if children are allowed to grow up in a place where they can experiment with any different type of colour or name or hair or toy. I think that and clothes. I think that would be amazing. But that's very different from a child who is the child who says, I want to play with a truck, to use your example, or I want to have my hair cut short, is very different to a child who says, I'm not a girl, and I think you keep calling me a girl, but I'm not. I'm a boy. And that's very different.
Many lesbians I know, including myself, said that as children. And
so including yourself, I mean, do you mind if I ask, so did you used to say that I am a boy?
Yes. And I used to say I must be a boy. I must be a boy because I didn't want to do the things that girls were pressured into doing. And by pressure, I mean that soft kind of societal expectation, not force or coercion, but the regular sex stereotypes that we've talked about. I know many lesbians, for example, who said, well, I must be a boy. I want to be a boy. I certainly wanted to be a boy. It would have made me normal during the time I was growing up because I was not wanting to date boys as I got into adolescence and the like. So what do you say about that, about the accusation towards trans activists that gender ideology is a pernicious form of gay conversion therapy?
Goodness, well, that moved on very quickly to trans activisms and pushing and gay conversion therapy. Goodness, I think, I mean, I've spent like 10 seconds understanding from you that you had a difficult childhood working out. Excuse me, I didn't mean difficult childhood. A difficult time working out your sexual identity and whether that would have been better to be a boy. But
I didn't. It was external pressure, which is what...
Oh, it was external pressure saying you should have been a boy.
No. This is what I mean about girls, and we can see today with the girls in Blackpool that were all in some kind of mental health facility and made up the vast majority of referrals to the Leeds GIDS 3 years ago that had all been abused and half were autistic and many were same-sex attracted.
Julie, I think we need to be really careful because you by saying all of these things, like most of them were abused and half of them were autistic.
But by their own definition of abuse and self-harm, by the diagnosis given to these girls.
However, do you know this diagnosis of these to have a sweeping statement that most of the girls in Leeds mental health unit were abused?
I'm talking about a group of girls who were advised by their social worker or medical professional.
I'm just wondering where this stat has come from.
GIDS. You can see this in the Tavistock statistics quite straightforwardly. How is
Tavistock medical records available for us to see?
No, I'm just being referrals from different. You know that the referrals from different parts of the country are available.
Okay, when you finish, I'll ask you.
Okay, so let's...
No, I want to ask you about that because it's really important because people are going to be listening to this and I don't want to leave it on the table that most of the girls in Leeds mental health unit who went to Tavistock had been sexually abused and half autistic, because I honestly don't think that data would be available to us because it's private medical data. So I think we just need to be really careful that doesn't leave on the table.
I didn't say...
Okay, I'm sorry. I misunderstood you.
So let's backtrack a little bit about the girls who face societal pressure, who are traumatised, some of whom are autistic, many of whom are same-sex attracted. Let's take, and these are not atypical examples of those that might attend a gender clinic, might contact you, or...
How do you know that, though? I'm really interested to know where you get this data from, because you seem to have this picture of girls who go to a gender clinic have these characteristics, and I'm like, that certainly doesn't fit with my patient cohort.
Let's then just assume that one of the girls, who claims to be a boy, who is both same-sex attracted and on the autistic spectrum, you have said that a transgender identity
I've said that transgender identity isn't a thing. Gender identity.
So you
is
have
different.
said what you would refer to as a trans child.
Mm-hmm.
You have said this is not a mental illness.
Well, I haven't said that yet, but I would say that, yes.
Yes. Well, I mean, you said it in the past that this is not
I see. Okay.
a mental illness, that you certainly wouldn't approve, and you have said this in the past, of a child who is mentally ill, has a mental illness.
Which kind of mental illness do you mean here?
PTSD, some kind of diagnosable depression or anxiety, for example.
Right, okay.
So some sort of mental ill health that's diagnosable, that these children should not be given treatment such as puberty blockers. Is that right? That no puberty blockers are given.
You're quoting me again as saying something. I think ask me the question. Yeah.
Would you think it's suitable to prescribe, or you said that they're not prescribed? That
I'd rather you didn't say things that I have said. I think if you're going to quote me, I would prefer it that you asked me so I could say it.
Would you think it's suitable for a child with a diagnosable mental illness to be put on puberty blockers?
Well, I wouldn't deny any child any medical care just because they had a mental illness. I think that would be awful. So I wouldn't mind whether we were providing care for cancer or diabetes or for asthma or for respiratory problems or for gender dysphoria. I wouldn't mind what it was that we were giving them medical care for, but I wouldn't say that just because they have a mental health problem at the same time as that other problem, that they shouldn't receive that care. I think, the skill of a generalist doctor is to look at all the things on the table and say, what have we got here? What help, what treatment, what support does this child need? And it may be multifactorial.
And would it occur to you to examine whether or not the fact that the girl is strongly identifying as a boy, saying that she wishes to become a boy,
a boy is something you don't become. You are a boy or you're not a boy. You don't become a boy.
So in your language, this child...
I think it's not just my language, Julia. I think this is the language of today. This is the language which fits with our
the majority
UK
of
law.
people disagree with you, Helen.
Julia, I think, again, people out there, I don't think that we should put... We can have a discussion here about our views, but I don't think we should say the majority of people, because we don't have the majority of people sitting here at this table. So I would like to not use that language.
Right. So I'm using the language because a girl is a girl, and she's come to you and she has said, I want to become a boy. You can reply to me in your terms with your language, but she has said to you, I want to become a boy. She also has a diagnosable anxiety disorder.
Okay.
Or she may be depressed and she may be showing signs of trauma. She may have been diagnosed as having some kind of traumatic response.
Okay.
So you would scrutinise, surely, whether or not, would you ask the question whether her claiming to be the opposite sex to which she physically and biologically is, if that is part of her mental distress?
I don't know. It's very difficult for you to answer that question. I'm a medical doctor, and when you are a doctor, you take a history. It's what we call it. So you ask your patient all kinds of relevant questions around their particular situation at the moment. And I think if somebody came presenting with gender incongruence as well as anxiety, I think, of course, you would need to ask about both. Is that what you mean?
No, I think I'm asking whether you think it's possible that these young people that say they are the opposite sex to which they biologically are, their actual biological sex, so they say they are the opposite, is that never, do you think, a symptom of a mental illness?
Well, when few minutes ago, I asked you kind of what kind of mental illness that you meant, and so you listed a few. So you said PTSD, which is post-traumatic stress disorder, and anxiety and depression. So you listed those three. Now, there is never a symptom of those three illnesses where you identify as the opposite sex to. They're separate. And I think what you're getting in a roundabout way is gender incongruence a mental illness? And it's most definitely not. And it is not caused by stress or anxiety or post-traumatic stress disorder.
So it's never the case then, in your view, that the reason why some girls might wish to escape their body is as a result of trauma that has happened to that girl with her body.
I have met patients who have been through trauma, horrific trauma, and it's incredibly sad. But the two are not related. There are many, many ways that children who have been abused will try and live through and after that trauma. But that is completely separate from gender incongruence.
And yet I have met and spoken to countless now women or even girls coming up to, say, their 18th birthday who desperately tried or even did socially transition. Some took puberty blockers for a time. 2 of them that I'm thinking of now started on irreversible cross-sex hormones, which 98% of those, as you know, who take puberty blockers do take cross-sex hormones when they're allowed. So it is obviously a pathway. But I've met so many that say that they were traumatised. They wanted to leave their bodies. They wanted to become a stronger person in order to fend off the abuse. And obviously, boys are stronger than girls. And this is the way that a traumatised girl might read her options as leaving that body behind, forming a new identity. But you think that's never the case with it's always about just a true internal feeling of, in fact, it's not even for you, is it, gender identity? It's that girl that I've just described, who's self-harming, who's been raped, who's been traumatised, she was always a boy, is that right? She doesn't become a boy. She's just telling you that she is a boy.
I mean, as always, when faced with these kind of arguments, it's almost like you have to put countless. I mean, countless to me is like infinity, kind of countless. I'm sure you haven't spoken to countless people, which is what you said. But then you said that you had 2 that swing to mind.
No, I pointed out that the 2 that had taken irreversible cross-sex hormones, and they find it impossible to detransition fully because of those irreversible cross-sex hormones that they were prescribed, having been on puberty blockers.
Let me go back to my answer. So, and the picture that you paint of that really extremely traumatized girl. I mean, it's almost like, to make your point, you have to use the most extreme example.
This isn't extreme. Many girls are traumatized.
Can I finish? And the examples that I would rather give you are examples of gender incongruent children. And the majority of those have not faced any abuse because the majority of children don't face abuse. And so there will be children who are gender incongruent who have faced abuse. And that is doubly sad for them because of the difficulties that life will throw them. But they're not related. You're not
so
abused and
related.
then you are gender incongruent.
So they're never related.
You will maybe you'll find people, like that terribly sad case that you described, who will try anyway to leave their body as you describe it because of the trauma that they've been through. And I feel for that girl, whether she's true or fictitious. I feel for her terribly.
No, she's true.
She's true.
She's true.
But I also don't think that horrific experience should then lay the path for all transgender children or no transgender children to access the healthcare that they need, because there will be maybe examples of extremely traumatized children who want to leave their body, as you say. There are gender incongruent children, they exist, and we know they exist because we have transgender adults who were once children. So if we accept that transgender adults exist, they were once transgender children. And I think that we need to make sure that healthcare options are available for them, and we shouldn't use the experiences of one traumatic case to deny that healthcare.
Well, there are many more cases than that, as we are starting to see. But Let me ask you a very direct question. Have you ever used the term genocidal to describe those that refuse to accept a transgender child as an actual thing?
Do you mean have I called a group of people genocidal? Is that what you're asking?
Yes.
Well, it's interesting that the Lemkin Institute used that exact phraseology in 2 of their recent publications, and they said it seems that the UK is heading towards a genocidal picture.
So have you referred to the likes of me as genocidal?
I would never refer to a human being in any such way.
But the ideology of, as you would put it, presumably of refusing to accept there is such a thing as a transgender child.
I think the actions of certain groups of people in this country at the moment it feels to me like it's heading towards a situation where they would prefer we didn't have transgender people, and that the rights of transgender people were like put aside or put in a different category, whereas I prefer to be inclusive to all, and very simply, a woman's space should be available to all women. If you want to just go back,
is what you mean,
to all women.
But,
yes.
Why did you post the video on? I think it was TikTok, but it ended up on Twitter with Auschwitz as a backdrop.
Yeah, I did that to make that point that we are. I put it on all the channels,
right.
Actually, and it feels to me like our progressive United Kingdom, our Great Britain, is becoming divided again, where inclusion and equality for diverse people is becoming undone. And in 2015, when I started my work with transgender people, as I said at the beginning, I was shocked at what I was seeing. And it seems we've got worse. We've got more fight for exclusion of transgender people in bathrooms, in sports, in female spaces. And I think that's a terrible thing. And it reminds me very much of what we should have learned from history, and why we continue to teach about the atrocities of the war, where you were lined up according to your identity or your culture, your religion, your belief, and you were lined up and you were executed. And it feels that division, that exclusion, it feels like that Britain is doing that again, and it makes me very ashamed.
So let me just clarify, because it's quite shocking hearing you say this.
Which bit is shocking, sorry?
It's shocking that you are using an analogy of the Holocaust to illustrate, for example, and there'll be more examples that you can give, but my example of a feminist who wishes to keep Karen White and Isla Bryson out of female spaces so they are safe from the potential of male violence. You're really using the analogy of the Holocaust to illustrate keeping those you would describe as trans women, and I would describe as predatory men in those instances, with the Holocaust.
I mean, I
think 6 million murders, with the systematic cleansing of the Jewish population and, of course, other groups alongside.
Including transgender people. That's how long they've been going in this country, because they were also lined up and executed, transgender people.
Well,
no, may I
yes,
answer?
Of course, please do.
I think what's actually atrocious is that you are able on mainstream, I don't know what this is, television, to say that transgender women are predators. And I think,
I didn't say that.
Oh.
I used examples.
I think you did.
No, I've been extremely careful and clear, I think, throughout. What I have said is there are cases such as Isla Bryson and Karen White.
Two.
No, there are so many more.
Oh, so many, countless.
So many more. It's fine. That's why we have Google. So many more examples than that. Mm. For the simple reason that they are men, and they offend, in fact, those men that trans-identify are overrepresented in prison as sex offenders, and that, again, easily Googleable. But I've been so clear throughout this discussion, Helen, that when I and others set up female-only spaces to protect women and girls from male violence, predatory men and harassment, it wasn't because we thought that all men, or even the majority of men, are sexual predators. We knew it was a sizable minority, and we can't tell which is which. So when I'm talking about keeping what you would call trans women and I would call men out of women's spaces, it's not because I have said every trans-identified man is a sexual predator, in the same way as I never said all men per se are sexual predators, just enough that we need to keep them all out in order for women and girls to feel safe and be safe. But you're analogizing it with the Holocaust.
I think if we gave, I said a little while ago, you did some great work on setting up these things that you talked about. And, I congratulate you for that. I wonder whether if we were, we've got new generations coming up ahead of this. And if the younger people of today, if they were going to set up these safe spaces for people to feel safe and for people to recover from trauma, I wonder whether they would set them up differently, because it feels a little bit like to me that you set up a women's only space and now the idea of the women that you're allowed in is getting different and you're scared of it. But I wonder whether the younger people would set them up differently. And instead of saying female only, they would say, if you are a victim of sexual assault, you will find a safe space here. Because we understand that although there are men who can sexually assault women, we also know that other people sexually assault women too.
Right. Well, I mean, I think it's going the opposite way to the picture you've just painted. Women are getting sick and tired of being told that these men are a subset of women. And
you can't speak for all women, Julie. You can speak for your group, your crowd. But when you say women are getting fed up, I don't think you can speak for all women.
No, I've never thought I could speak for all women. And also, I think it's very damaging the way that extreme trans activism, and I put you in this category absolutely, has really blighted the lives of trans-identified people that just want to live peacefully and quietly. And it's been the worst thing. Trans activism in the last 10 years has been the worst thing for those people.
So you're feeling sorry for trans people now?
And what I would say to you about would young women set up these services differently? It's going the opposite way. The scandal, as I mentioned earlier, with Edinburgh Rape Crisis, Middle Wadwer, a man who was head of Edinburgh Rape Crisis and hounded a woman out of her job, a very good woman who counselled rape survivors. That really did speak to an awful lot of younger women, as well as the general population. And when it was discovered that there was not one single female-only sexual assault service across Scotland, and it had been done by stealth, it had just been changed by trans activism and gender ideology, insisting that these women have to, or rather just claiming that the men that identify as women are actual women. There was an outcry, and it was many young women as well. And now, of course, we have Byra's Place, that is a female-only facility that was founded and funded by J.K. Rowling out of a necessity, out of a need. And it is extremely busy and successful at what it does. We also have the legal case, the successful legal challenge that Sarah Surviving, took against Brighton City Council because she was hounded out of the sexual assault centre that she visited to discuss her trauma as a survivor of childhood sexual assault by a man and then the rape by a man in adulthood. And again, men who claimed to be women were the ones given precedence. They were the ones who mattered more than this female sexual assault victim in a so-called women-only space. And they have now pledged, we'll see if they go through with it, to provide female-only space. And women do not want to be amongst men.
I don't think you speak for all
sexual
women.
assault victim.
I'm a woman.
Involved in these campaigns about sexual assault and the trauma coming from sexual assault for all of my adult life. Women don't even want to see a male
all
doctor when they go to a sexual assault referral centre. In the main, you can come up with exceptions all you like. Women want a space away from men however they identify when they've been sexually assaulted.
Okay. So you said quite a lot there. I'm just going to pick up again just to clarify my position. My position is that transgender people do exist and they're protected in law. So they are categorised as having a protected characteristic in our law. So we understand that the transgender women that you call men, which I find extremely offensive and verging on what we would call a hate crime.
They're men.
That makes you laugh. But they're
men.
Okay, but let me finish. So our law accepts that there is gender reassignment. So they are women. And you're and you know, the history will show us, Julie, whether you are standing on the wrong side or the right side.
Well, history doesn't have
and
a side.
And I haven't finished. So if you will allow me. So I just want to make that point very clearly, that the law accepts that transgender people exist. And that means that transgender women are women. They're not men.
That's
and
not the law.
To refer to them as men is highly offensive. And you've given some sad and tragic examples, which, you know, and I go along with that. I worked with victims of sexual assault, as I said at the beginning, and those are tragic examples. But what I don't think that our world today wants to move towards is the exclusion of a particular group of people. And I don't think that all transgender women should be excluded because of one or two cases that you have been able to kind of name. I think we're working for equality and inclusion of everybody, and that's a much fairer Britain.
So in other words, we really shouldn't have single-sex facilities at all. We should make it open to people of all genders, you might say.
I think the facility, it's a bit, if you want to talk about bathrooms for a minute, I think it's more about what does the facility offer. So if we go back to the bathrooms, you know, in that bathroom, is there a urinal? Because it's easier for someone who has a penis to use a urinal. Or is there a cubicle, a sit-down toilet? Because it's easier for someone who doesn't have a penis to sit down on the toilet, or if you need a number 2 to sit down on the toilet. Or is there a squatting toilet in that cubicle? Because there are some cultures that squat on the toilet. So I think rather than saying because you have that particular characteristic can only go in that space, I think we should say what the space is for. And I've talked about toilets, and for sexual assault centres, the centre is for people who have been sexually assaulted, and we need to make that space safe.
No, the centres were set up for women and girls.
Okay, well, I was just explaining that I think it would be better that we had the service for the service.
So do away with sex-specific services. So you said about sports recently on a programme that you were on, that, of course, we should look at who is being excluded from female sports. So the IOC have now made a decision that bans men from women's sports. Some of the headlines have been that trans women are now banned from women's sports. But all it's done is just reassert that women's sports were set up for very obvious reasons in terms of difference in strength and muscle mass and lung capacity, etc., and speed and grip. And therefore, it doesn't matter how a man identifies, female sports remain female. But you said that it depends on whether or not...
Are you quoting me again? Because I think maybe it would be better to...
Yeah, do you know what we'll do? So
ask the question rather than
what I'll
me.
do, so obviously, so we're not misquoting each other, is I'll ask the question to both of you in relation to what you've just alluded to there. So obviously, recent announcement from the Olympics. I just want to get your take, though, because I don't think it's been highlighted during this interview, and I don't want Julie to reference sort of a quote and what have you. Do you accept biology? Not as an identification, but just the human anatomy, as it were, and that biological males are going to have advantages over, for the most part, biological females? Well,
I mean, that was two questions. So do I accept that there's biology? Mm-hmm. Yes. Do I accept that if you lined up 10,000 men and women, that the majority, the men would be stronger than the women? Yes.
Okay. So then that would segue into the next question in relation to, obviously, and I'll put this to you, Julie, first, in relation to sports. So you've referenced with regards to biological males who have now identify as trans women.
Identify as women.
Should they be able to compete in women's sports?
Of course not. We have a women's sports category for very good reason. And even if you look at non-competitive, even if you look at the type of sports that do not require physical strength, you might be playing poker. There are many women who say they don't want to play poker with men. They want their own poker team. They don't like the way that men play poker. I don't know how men play poker. I've got no idea.
I don't play, unfortunately.
But they have every right, if they think that there's a lot of sexism and bantering around, like there might be with darts, go ahead. Have a women-only category. And I'm against sex segregation. For example, the idea that you should have a female-only carriage on the underground to stop sexual assault. No, just make sure that the underground is policed properly and that men know there are consequences. Don't hive women off into a separate category. But who on earth thought it was a good idea to argue that men, because they identify as women or because they've been taking estrogen, that their testosterone might be lower, that this still makes it fair for them to compete in a tennis match, in weightlifting, in any sports, in running? That's how bonkers gender ideology has gone.
What do you mean by gender ideology?
Saying that a man who identifies as a woman is a woman.
Oh, because that's what our law says. Our law
It
protects
doesn't.
people who have reassigned their sex.
It really doesn't,
But we
Helen,
just
and the
went-
more you say it doesn't make it more true.
But we have two laws. One is the Equality Act, which protects gender reassignment.
We've been through this.
Yes, and I was right. And if you read the clause,
You
it
weren't
says...
right.
Okay, I'm just going to say it once more. So people who have undergone gender reassignment
Are not women.
have reassigned their sex
That-
under
no.
the Equality Act. That's what the Equality Act says.
Helen, it doesn't matter how
So
many times you say it.
just to keep this on topic in relation to sport. So obviously
We do, but also, there will be transgender people listening to this show, and I feel obliged because I'm representing them here today, and we haven't got a trans person on this panel today. I feel obliged that we don't just skirt over the fact that it's okay to say that they don't exist, because our laws do accept and make provision for people who have reassigned their sex, transgender people. So I don't feel it's okay to just skirt over that.
They're not
here.
women.
In your view, perhaps if it was in your view, in my view,
No.
you could say that.
We've had clarification.
So just-
but
just
is it fair for men to compete in women's sports?
It's fair if you're going to create a category of sport for women, and we talked about this before with women's only spaces, women's only sports, women's only bathrooms. If you're going to create a category for women, all women must be allowed to play. And so maybe the difficulty is that we created two categories. And earlier we were talking about how many genders are there? Are there 100 genders, or are there more? And we identified then that there were more than two genders. So maybe the problem is that historically we've created only two categories for sport. But if we are going to create two categories for anything, one being male and one being female, all male people must be allowed to play in the male, and all female people. And now, does that give advantage? Now, yes, I think,
By all women, sorry, can I just... those that you would refer to as trans women, do you mean they should be...
I mean all women. So you
mean those that were, as you would put it, assigned male at birth,
Mm-hmm.
who've been through gender reassignment, those women.
Yeah.
So you think that men should then be able to compete against
I think
biological women?
Women should. You see, Julie, you keep saying that they're men, but they're not men, they're women. And if you create a women's sport, then all women must play here. You can't put a woman's sign on and say only my particular type of woman can play
Well,
here.
yes, a biological female.
What do you call a biological female?
You know fine well. You're a doctor. You know fine well what a biological female
No, but I'm
is.
asking you what you think of. I mean, you kind of clarified the conversation by saying you mean a biological female. So I'm just wondering what you mean by
Dictionary definition: the adult human female works for me.
what does that mean? But what is it though?
No. This is a ridiculous question.
Oh, sorry.
This is utterly ridiculous. Whoever is
Do you mean
so far down.
chromosomes? Is that what you mean?
And if you start coming onto the
you said
the
it,
intersex
biological.
argument,
I'm not
then
going to. No, I'm not. I'm just interested what you see as you said
a
it.
biological female.
Okay.
So you think that biological men who identify as women should be able to play in those sports?
They're women's
because
sports.
They are women.
Because they're women, yeah.
Okay.
So just on that, obviously I know you don't work for the Olympics, you're a doctor, but what would you to level the playing field, as it were?
Yeah.
And obviously if we're not segregating men and women, what could, like the Olympics, for instance, what could they do to make it a level playing field?
Well, it's never really been a problem before, so I'm not quite sure why it's such an urgent problem right now, because we've had transgender people, well, we know at least since the war, because we talked about it just a few minutes ago, that transgender people were lined up on the impure side. So we know at least that for over a century we've had transgender people, and there's never been a problem in sports. But now, all of a sudden, it seems to be everyone's favourite topic, everyone's debate. We're talking about sports. But are we worried about letting transgender people in sport, or are we worried about people with an unfair advantage? Now, ask me that one, and I'm much more passionate about not allowing somebody who has unfair advantages. But to say that all transgender women have an unfair advantage simply because they were assigned male at birth is not true. It's not correct, because they don't all have a physical advantage.
So what's the point of a single-sex category then for sport? I know that you say that these men are women, so let's just acknowledge that. Mm-hmm. They're not, they're men. What's the point of having women only anything?
I don't know. It just seems to be historical, really. A bit like, and a bit like the women's only spaces. I reckon if we created them afresh, I don't think there's a need to have a women's only safe space. I think we just have a safe space.
So women aren't harassed or raped or scared?
One other thing, I think I've seen many men who have been harassed and raped and scared. And I
by women?
By either gender, any gender. And it's terrible. I think, assault of any kind is terrible. And actually what happens in our country is that we've progressed to allow women to come forward more easily. Where, in the olden days, if you stood up in court saying you'd been raped, you were, you had a horrific experience, and we've come on. But I know from my own profession that there are many men who've been abused who do not come forward and be counted because of the shame.
Not having a women-only space, though, because there are men who advocate for male sexual assault victims, and so they should. And those male survivors should have support and provision. And this is a completely different argument about whether or not we should have sex-exempt categories for anything. And what you've argued is that we shouldn't have female-only sport, we shouldn't have female-only prisons, we shouldn't have female-only anything.
Because I think once you're only allowed in here if you have this category, what you're doing is actually excluding. So by including that
excluding
group,
men, which is what we did because of the danger.
And I think the way that the world is moving forward, I know you feel men are a great danger.
I've been very clear about this, Helen, and I have said a sizable minority of men, and this is every single piece of credible research on the planet.
Oh gosh, we're going even wider now. So every single research on the planet. It's huge. It's countless. It's
this.
Everybody. It's all women. It's all men.
Every 3 days dies at
Julia,
the hands of a man. You cannot refute this evidence.
No, I can't.
The refuges are full to bursting of women and their children. The rape crisis centres are oversubscribed with women who are desperate for support. And all of a sudden you're arguing that people should just set up facilities for people and that trans women should be allowed in everywhere. What's the point of having a women
Everyone. We need safe. No, there isn't any point.
The men render them potentially unsafe.
Men, basically, again, it's like the men. Women are assaulted by women. Women are assaulted by grandparents. Women are assaulted by men. But by just saying it's only the men that are perpetrators. But I've never said it's only the men.
And I haven't said that I would go around looking at this particular category of vulnerable person and help set up services for them and a refuge for this particular group. There are vulnerable groups everywhere. And what I've said is that feminists are the only social justice movement, if you want to call it that. I've come to hate that term. The only campaign that centres women and girls. It's the only one. It's the only one.
I centre all people. I don't just centre women and girls.
I know, you're a peopleist, but Let's look at what you...
why is that bad?
No. I'm saying you have said you don't believe in single-sex spaces.
If I go back, because I wasn't able to finish my point, and I'd like to, is that if you set up a space for a particular characteristic, you exclude other people. If you set up a space to provide a service, then you include. And I think that that's a more progressive way of looking at life.
And with that,
protect services rather than exclude groups.
That's clear. And with that, you presumably would not feel comfortable with transgender people, for example, having their own group or services. You think that should be open to everyone as well?
Well, if you walk down the street and you have males only in here, all males should go in there. If you have only transgender people allowed in here, then only transgender people are allowed in here.
But what if I say that? But I'm a transgender person because I definitely...
I didn't know.
Of course I am.
Are you?
If for the purposes of self-identification, I can go into that group and nobody can stop me from going into that group. What does it mean, a group for transgender people only? If what you've said is a group or an organisation that's only for women allows men.
What does it mean for women? Like you say, or what does it mean to have a group that's only for transgender people? What does it mean to have a group only for women? It means that people who are women come in here, and women
some
have
of whom are men.
They're not men.
So you have said that you believe in being kind and good, and this is clearly
inclusive as well.
And inclusive, and that you care about everyone in general. You don't differentiate.
I do, yeah.
Do you also care about those detransitioned young women like Kira Bell, who obviously you would argue perhaps, tell me, I don't know.
Don't tell me what I'm going to argue.
Tell me. you would suggest that she might be a rarity, or are there other detransitioned young women, and presumably you care about them too. You care about their stories.
Of course I do. I care about all stories. I care about all people.
So if detransitioned young women are saying to you, I was allowed to access puberty blockers at the time that I did, and I went on to take cross-sex hormones that are irreversible, and it was a huge mistake. What would you say to them?
I'd say it's very sad. And I feel for them. I feel for anyone who's made a mistake. I feel very sad for them.
But you think that we should take the word of, I would call them children, you might refer to them as adolescents.
When
young people.
So we're clear, because we're going to differ maybe. What kind of age group are you talking about?
Well, for example, if a 6-year-old, an 8-year-old, a 10-year-old, a 12-year-old.
Okay, we've reached which one? Give me one.
All of them.
Okay, so a 6-year-old, they don't need any medicine. An 8-year-old don't need any medicine. 10-year-old, maybe if they've started puberty.
Might you validate their trans identity?
I validate their identity.
Right. So you would feel comfortable with accepting the word of a 6-year-old that he or she is in fact the opposite sex, is a trans child?
Yeah, definitely. Right. And I've seen the harm and the damage that happens when you have a child who's saying, you keep saying that I'm a girl and actually I'm a boy. And I get to hear the stories a few years later on, because that's when they come to see the doctor. And I see the harm of that denial. I see it, and I've seen it so many times. So when that child, for the first few years, mum and dad are saying, I don't know about this. I don't think that's a good idea. I don't think we should do this. And then a couple of years go by and they're like, okay, well, I think this might be a thing. I think actually and the difference in that child when they are actually believed. And I think any child who tells you something should be believed.
Really?
Yes, I do.
So you believe that a child that tells
Please
you something...
don't give me like a cat or something example now, because we're talking about humans here.
No, but you would believe a child who says that they are the opposite sex?
We can say the word girl or boy here, can't we?
So
someone comes and says, "I got it wrong."
So a 6-year-old girl who says that she's a boy.
Yeah.
You accept that girl is a boy.
Yeah.
A 6-year-old.
Why wouldn't I? What would I say? You're lying. You're make believe. You're making this up.
Well,
you're not telling me the truth.
You wouldn't be You would not be cruel or harsh to that child, of course. What I mean is, would you action that? Would you keep an eye on that child with a view to saying yes to the puberty blocker request when it comes through?
Well, we've got a 6-year-old, so luckily, we've got, if that 6-year-old's coming forward saying, actually, I don't think I'm a girl, I feel like much more like a boy, we've actually got probably 4, 5, 6 years. So, I know that...
To indoctrinate them.
To indoctrinate them, oh my goodness. I would never indoctrinate a child. Is that what you would do?
Through validation, through affirmation. I've interviewed many parents whose children, I've interviewed many parents, and my podcast series is there for anyone to listen to.
I don't think it's advertising time, by the way, but anyway.
Oh, no. This isn't advertising. This is, if you want to hear the voices of those parents,
I see.
you can listen to their voices, although I'm sure you won't want to.
No.
You don't want to listen to the voice of the parents, no.
I don't want to listen to your podcast, no.
No. But I'm talking about the voices of the parents.
But I've spoken to very many parents, so I have my own cohort of parents. I don't know how many episodes of your podcast you've had, but I'm not bereft of speaking to parents of trans children.
Were really desperate to get their voices out when they realised that through their initial, some of them through their initial affirmation of their child's gender identity, seeing them be encouraged at school or through social services, CAMS, wherever, to socially transition, that many of those young people were already on a path of being determined to then access puberty blockers as soon as they can, and cross-sex hormones, which we know are 98% of those that take puberty blockers that would go on to access cross-sex hormones that are irreversible. So yes, indoctrination, yes, affirmation and social transitioning is not a neutral thing. And yet you're talking about a 6-year-old child. What about a 2-year-old child?
Well, 2-year-old, I think 2 is a funny age because they can only just about walk and maybe only just about talk. I think maybe it's a difficult one. And so I don't think a 2-year-old would be able to say the words, I am a boy or I am a girl, and you've got it wrong.
Well, Nancy Kelly said that they know their gender identity at 2.
She knew, like looking back, but at the age of 2, 2-year-olds don't have that ability in language. I don't know how many 2-year-olds that you have in your world at the moment, but they don't have that ability. But looking back, they can think about back, if they can remember that back to 2, and we talked about that earlier, that memories aren't really formed till 5. Or often they have memories from grandparents or aunties and uncles who say, God, you know what, when you were 2, you were like this. So that's where that memory comes from.
And what is like that, though? Is it about the, what you might call, I don't know, gender nonconformity? Would you use that term?
Well, conforming is what I don't really like that term because it implies that you have to conform with something. I think gender expression, gender identity, gender. I think those 2 words, but I don't really like non-conformity, gender incongruence. Those are the kind of words which are more inclusive, I would say.
So let's go back to the grandparent or the aunt or someone who has a memory of the child behaving as a 2-year-old, a 3-year-old, wherever. And what might they pick out as something that showed that child was a boy all along or is a trans child? What clues might there be?
It was definitely the Barbie doll in the truck and the wearing the pink and the blue.
Seriously,
is that what you want me to
clues
say?
What clues were they? I'm very interested to know.
Well, it's. I think it comes back down to what is a female, male and male gender, and how do men and women, boys and girls wear their gender? How do they express their gender? How do they feel their gender? And it's all very different. So it's about the incongruence is the main point.
What do you mean by that, though?
It means that, for example, that school or home would say, you're a boy, all the boys line up here, boys, you go out and play football and what have you. And that girl is saying, it didn't feel right, it doesn't feel right. I don't feel like one of the boys. I feel like one of the girls. I feel like I should be on that group. So it's a much more, rather than specifics like pink and blue, it's more of a feeling of community. Which side do I fit best? Where do I see myself best?
You said earlier that you don't hold much truck. You don't. You're not one. Just to paraphrase, if I may, and please correct me, that you're not someone who would demand an adherence to the kind of pink and blue nonsense, and that children should be able to play as they wish and be free to play whether they're boys or girls. There should be no rules in this sense. So I'm just interested to know then how you might, looking back, how one might consider that a young child, is transgender. If it's not that it's a boy who wants to wear skirts and favours pink and says that he'd rather play with the girls, what is it then?
It's a much more general description. And I think, we categorise children into boys and girls. And then when you categorise them and say, right, all the girls go over there, the transgender boys will go, well, I know you think I'm a girl, but going over there doesn't feel right to me. I feel I would really much fit in better and I'm actually one of this group. But you, because you have very fixed views on me, think I should go over there. So it's you can't explain it in knives and forks and pinks and blues and trucks and dolls.
And is the solution not then that we just treat children as children and say there doesn't have to be a boys' playing area or a queue?
Now we're talking. Now we are actually on the same page. So I would love that.
And then would that eliminate the necessity for children to wish to identify out of their own biological sex?
What does that mean?
It means that if boys,
I thought we were just saying that
girls,
everyone could just be anyone, and we didn't label people,
which is exactly the bedrock of feminism, my feminism anyway. That girls and boys should not be.
You've spent the whole day saying that men are dangerous and we should fear them, and now you're saying that we should.
I've been
put them all
extremely
together.
Clear about this. I have said every time I have mentioned this point that a sizable minority of men commit acts of violence.
Okay, let's go back to the children. I don't want to go back to men being violent.
So I'm just conscious of time here, ladies. So obviously we've probably got about 5 minutes left. So I'll give Dr. Helen the right to reply to you there, Julie, and then we're just going to do closing statements.
I have nothing I need to reply to, unless I've missed something. Have I missed something?
Oh, well, you were talking, but I jumped in, Julie.
I see. I said actually I didn't want to go back over men and
So I think we found, I think you've argued your cases and defended your cases quite amicably, quite professionally, albeit hopefully there's been entertainment in some capacity for the listeners. There certainly has been satire, and it's, tried to remain as impartial as I could. Suppose it's just closing statements now. So obviously this isn't an opportunity to reply to one another. This is kind of you addressing the audience here. So we'll start with Dr. Helen. What do you think we can do to move forward as a society?
I think I was talking to a transgender man yesterday, and I said, if you had a magic wand, what would you wish for? What would you do sprinkle fairy dust with? And all he wanted was acceptance to be himself, to be able to live without fear. And I think that would be wonderful if we as a society could just simply accept that transgender people exist, and they're not asking for anything special. They're just asking to be able to be accepted as who they are.
Okay. And same question to you, Julie.
I'd like to see an end to the medicalisation of children. I think it's a human rights violation on a unprecedented scale. The idea that children can be trapped in the wrong body, that can become the opposite sex to which they were born, and the horrors of the lifetime of treatment and social exclusion that comes with that, when what we should be doing is saying, be as you are, behave as you wish, outside of sex stereotypes, is the way to go. This is a huge medical scandal. And it's also a scandal that women have had to fight yet again for the right for safety and single-sex spaces that we so desperately need, while some men are still intent on sexual and domestic violence towards women and girls.
And on that, we shall close. Thank you very much for your time.
Thank you for having us.
I would love to know what people's thoughts are. Obviously, I'm all a big advocate for free speech, ideally within reason. So do you agree with Julie Bindel, or do you agree with Dr. Helen Webberley? I really want to know what the verdict is and the feedback is from this episode. Thanks again for your time,
Thank
Julie,
you.
Dr. Helen.
Thank you.
I've been Daniel Hodges. This has, of course, been Julie Bindel and Dr. Helen Webberley, and you've been listening to the Hodge-Cast. Take it easy. Thanks for listening. We hope you enjoyed this episode, and we believe you can definitely take something away from today's guest. We couldn't attract guests such as this without a solid fan base. The best way we can grow this is through subscriptions. So, if you haven't already done so, can I please ask you hit that subscribe button and help us continue to put out content for you all to enjoy. Until next time.